Dale, what I'd like to do throughout our conversation here is really empower people. And this is for everybody. The person out there who wants to be preventative, the person out there who is starting to suffer with a little bit of cognitive decline, all the way to Alzheimer's. So, what I want to do with you today is take some time, really get into the nuances, the latest science on how we can help people and empower them when it comes to taking care of their brains. Are you with me?
Absolutely. I think that's a fantastic thing to do. And this is the only way that you're really going to reduce the global burden of dementia. To get it so that people will start early, get as many as possible, get on prevention, but then have something even for those who unfortunately wait until late, which I hope nobody will do in the long run. Still, we'd hope to have something for them as well.
Well, let's keep those people on who maybe are quite far down the rabbit hole, or they're a caregiver of somebody with Alzheimer's.
Right.
What kind of hope do we have for those people?
Well, this is a really good point. And I call this false hopelessness. People in medicine talk about false hope. But what's happened is there are so many people now who are improving that, in fact, it's really more about false hopelessness. We tell people, oh, there's nothing you can do. And in fact, there's a tremendous amount you can do. And in fact, a couple of years ago, I got a really interesting email from a man who said, you've been telling people that if they're past early stages, and what we call early stages is an important semantic issue here, because just developing MCI is a relatively late stage of the disease. It's like, mild cognitive impairment is like saying mildly metastatic cancer. It's a relatively late stage of the problem. And yet we're having great results with that, and even into Alzheimer's disease. Now, this person's wife had a MoCA score of 0, so she was at end stage. And so he was reluctant initially, and then decided, okay, he's just going to basically go through the protocol that we developed. And actually, she clearly improved, and she started dressing herself again. She started engaging with the family again, speaking again. So he wrote to me and he said, how dare you tell people that, you shouldn't get on this if it's late. So, okay, fair enough. However, as you know, it is more and more difficult as you get later and later. So typically you've got to do more and more things to get a really good outcome. Now, here's what we've seen. We've seen people go from MoCA scores. MoCAs go from 0 to 30. 30 is perfect, which is most of us should be 28, 29, or 30. 0 is end-stage Alzheimer's disease. We've seen people go from 18, which is relatively significant Alzheimer's disease. The average for all Alzheimer's patients is 16.2. So by the time you get to 18, you've lost a lot, and you've probably had the underlying process for about 20 years. We've seen them go from 18 to 30. However, we've seen people go from 0 to 9, which makes a huge difference in their lifestyle and their engagement, as I mentioned earlier. We have not seen anyone go from 0 to 30. And that's my hope. Before I'm gone, I'm hoping that someday we will understand, what does it take to take someone all the way? Do we need more stem cells? Do we need more intranasal trophic factors? Do we need more appropriate stimulation? What is it that we need to get people to go from 0 to 30? So this, again, is why I say, get in early. Now, you asked about, what about people who have this in their family and who's got someone's maybe sitting in a nursing home with a score of 0? The first thing to do is to get the entire family evaluated. Get them a cognoscopy, what we call a cognoscopy. So just as we all know, if you turn 50, you should have a colonoscopy. And when my wife and I turned 50, we went and had on Valentine's Day and had his and hers colonoscopies just to get it out of the way. And just like, okay, now we know we're not having problems here in the next few years. The same thing is true for a cognoscopy. For anyone who is 45 or older, please get a cognoscopy. It's relatively straightforward to do. You can get the basic blood test that you need, a simple online cognitive assessment that will only take you about 25 to 30 minutes. And then if you already have symptoms, or if you're doing poorly on the test, get an MRI with volumetrics. But if you're just there for prevention, you don't need the MRI. So the first thing I tell everybody who's in late stages, please have the whole family. Let's make sure that at the very worst, we end it with this generation. My generation, this is a huge issue. Our daughter's generation, they're not going to have to worry about this because they will get on early prevention. Then the second thing is to get the person evaluated and get them on the basics, get them with a mildly ketogenic, plant-rich diet, get them to have appropriate periods of fasting, get their ketone levels up, make sure they're insulin sensitive, make sure that they don't have ongoing inflammation, make sure that they don't have ongoing infections that are undiagnosed, a very common problem, make sure that they don't have toxin exposure, ongoing vascular disease, sleep apnea, poor oral microbiome, gut issues. The basics, and you can actually help a lot of people.
So I want to make sure we connect the dots here. A couple things you brought up. You mentioned people getting tested, having their brains tested around 45, but you also said that people start suffering with mild cognitive changes far down the continuum. So that means there's this whole period of time beforehand where people might not be symptomatic, or it sounds like they're not symptomatic, and maybe they're below that 45 age variable where they're being tested. So how do people in that bracket determine where they're at along this continuum?
This is such a good point, because the big problem has been that people wait until they keep saying, well, there's nothing we can do about it anyway, so let's not find out what we have. And everything in Alzheimer has been backwards because there hasn't been anything to offer. And so people say, oh, it's probably not Alzheimer's. If it is, there's nothing you can do. Don't bother to get checked. A very common thing that we heard even recently is, quote, there is nothing you can do to prevent, reverse, or delay Alzheimer's. And nothing could be further from the truth. There's a tremendous amount you can do. So what your question really gets at the heart of what Alzheimer's is. So what we found in the laboratory is that Alzheimer's is essentially a network insufficiency. So you have all these things that are critical, just as you would for running a country. Your brain is very complicated, and all these things you got to check all the boxes to make these things work. So here's the thing. If you understand the 4 phases, then that will give you an answer to your question. So when you develop Alzheimer's, and when we call it Alzheimer's, when it's dementia, that's the 4th of the phases. Phase 1, you have a period, just as you alluded to, that may be in your 20s and 30s, where you are actually asymptomatic. But if you had a PET scan or spinal fluid, you could already tell you are in the earliest phases. The second phase is what's called SCI, subjective cognitive impairment. And what that means by definition is that there's something wrong, and often your spouse, your significant other, or maybe some of your coworkers will know something's not quite perfect. And yet you're still able to score within the normal range on cognitive tests. Now, the good news is that period lasts on average 10 years. And I say 45 just because we can reverse everybody who's in SCI. We see it all the time. It's relatively easy to do, which is why in the long run for public health, we need to have a tiered system. Everyone goes on some basics. A few people fall through the cracks. You do a little more. And that's the way you can actually do this relatively inexpensively. There will be a few people that are really tough, and they've got to have more evaluation and more treatment. So the second phase is SCI, lasts about 10 years on average. The third phase is what is called mild cognitive impairment. And as I said earlier, it's an unfortunate term because it is like saying you have mildly metastatic cancer. It is a relatively late stage of the process. However, in our clinical trial that we just published, and you can look at this freely online, this trial showed 84% of the people with MCI or even early stage dementia, the 4th phase, actually improved with their treatment. So we're very excited about that. Then by definition, MCI means there's some problems, and in fact, you're now testing abnormally, but you have continued to be able to do your activities of daily living. When you begin to lose those, you're having trouble caring for yourself, you're having trouble doing your daily activities, you're paying your bills, figuring out tips, the basic things that you do in an everyday life, doing your job. By definition now, you are in that 4th stage. You now have dementia. And so that is a very late stage of the process. And yet again, we're seeing people, even in that situation, turn things around. But it gets harder and harder as you go on. Therefore, to answer your question, yes, if everyone would just check at 45, then you'll be able to find where do I stand. And if you're already scoring imperfectly on the test, and it does sneak up on people. We have people, this happens all the time. We had a woman who came in and said, I think I'm fine, but it's in my family. I want to make sure I'm okay. She scored a 23 out of 30 on the MoCA. So she already had very significant MCI. She got on our protocol. She now is getting 30s. She's doing just fine. So that's why, if you do it at 45, it's fine for most people. Now, there's one caveat here, which is that less than 5% of people actually have familial Alzheimer's disease, where they have a mutation in amyloid precursor protein, presenilin 1 or presenilin 2. It's rare, it's relatively uncommon. For the 95% of us, fine at 45. If you have a truly familial Alzheimer's and people are starting with symptoms in their 30s or 40s, then just take when their symptoms are starting, subtract 15 years, and that's when you should get your, if they're getting it in their 35, yes, you're right. Get it when you're 20. And yes, PET scan abnormalities in people who are ApoE4 positive can begin in your 20s, but they may not have symptoms until their 40s, 50s, 60s.
Let's get into some of the more specifics around genetics. You mentioned their ApoE4. Let's talk about percentages and how we inherit different pieces of that from both of our parents and how common it is to have all the different patterns.
Yeah, it's a great point. So, of course, with these various genes, such as ApoE4 and the about 20,000 others that humans have, of course, you get one copy from your mother, one copy from your father, typically. And so with ApoE4, this is apolipoprotein E. It's a very interesting gene. It's one that is involved with a pro-inflammatory pathway, among other things. And the primordial one, so when we descended from the simians, the first hominids had ApoE4 only. That was the only one. That was the only allele. So typically it comes in 3 standard alleles, 2, 3, and 4. Others are very, very rare. So most of us are 2, 3, or 3, 3, or 3, 4, etc. And so, for example, I checked myself. I'm an ApoE3, 3, which is kind of vanilla. That's the most common. So
that's what I am too.
Yeah, and that's what 3/4 of our population is. Now, what that means, Jesse, is that you and I have throughout our lifetimes about a 9% chance of developing Alzheimer's. It's not zero. We'd like to make it zero by doing the right things and getting the right evaluations. Now, for 75 million Americans, they have one copy of ApoE4. So they got it from either their mother or their father. Their risk, instead of 9%, is 30%. Most of the people do not know that they have this. This is why we recommend everyone, please get tested. And again, the standard of care is not to check your ApoE4 because there's nothing you can do about it. And in fact, there's a tremendous amount you can do about it. And there's a whole wonderful website called apoe4.info, started by Julie G., who is an ApoE4 herself and has done very well on the protocol we developed. And in fact, some of her own things that she developed prior to my meeting her years ago. She's now been 10 years on this and has gone from 35th percentile on her cognitive testing to 98th percentile, done absolutely beautifully. She's really a citizen scientist now and actually worked with me to write the book, The End of Alzheimer's Program, because she's the one who's using it every day. So it's been great. So that's 75 million Americans, about a 30% risk lifetime, tremendous amount that they can do about it. Now, there are 7 million Americans who have 2 copies of ApoE4, and they are at well over a 50% risk. In some studies, as high as 90%. Of course, it depends on other genetics, and there are over 50 different genes that have some degree of influence on your likelihood, your probability, your risk for Alzheimer's disease. But the most common one by far is ApoE4. And there are others, things like TREM2, for example, that have gotten a lot of press recently. And there's even a trial on TREM2. But the reality is that the most common one is ApoE4. Now, as I mentioned, for those few people that actually have familial Alzheimer's disease, where they're getting it in typically in their 30s or 40s, and everyone in the family is getting this, so everyone who has the gene, that's just 3 genes, APP, which is amyloid precursor protein, PS1, PS2. Those are the ones, but that's the uncommon situation. So again, everyone should know their ApoE4 status. And you actually should live a little differently if you are ApoE4 positive. Number one, you have a more pro-inflammatory state. And as has been pointed out by Professor Tuck Finch from USC, this is probably partly what helped us to become hominids. We came down out of the trees. We were walking along the savannah. We were puncturing our feet. We were getting infected. We were eating raw meat. There was no cooking back then. We were eating raw meat filled with microbes. So actually having this pro-inflammatory state helped us to survive. And you see this live on today in third world countries. Those who are ApoE4 positive and have this chronic pro-inflammatory state actually do better and have better cognition and better longevity because they're constantly exposed to these various pathogens. However, for those of us who are not living in the third world, we actually have a pro-inflammatory state with ApoE4, and so we have a slightly shorter lifespan and, of course, a markedly increased risk of developing Alzheimer's. Great. So we can address that simply by having anti-inflammatory diets, by recognizing people who are ApoE4 positive actually absorb fat better. So follow your lipid numbers. You may go a little bit longer with your fasts at night, things like that. So the good news is we can make it so those people do not have that increased risk, and everyone should do that.
That is so fascinating. Nature doesn't make mistakes.
Exactly.
And this ties into another point I want to make about nature. A lot of conventional wisdom would have us think the amyloid that is associated with Alzheimer's is something that we need to remove, and it's a mistake by the body clogging up the brain in its simplest form. But I want to get into this. This is actually, your research and your paradigm talks about how this is actually part of a protective mechanism from all the variables in our environment that are bombarding the brain.
Yes.
So I'll have you expand upon that and what we can do knowing that.
Yeah, this is such a good point. So what happens here is that, again, everything is backward because people believe that there's nothing you can do, that this is due to amyloid. You look in the brain of a patient, what do you see? You see a lot of amyloid plaques. And then there was work done years ago. If you make mice create lots and lots of amyloid, they get something that looks like Alzheimer's. Aha. So the idea was, okay, this must be due to amyloid. And there was a nuance that was unfortunately missed here, that sure, you add a lot of amyloid, and of course, you get a problem. But that doesn't mean that what's causing the problem in the majority of us is due to amyloid. It simply means that amyloid is there. So here's what it turned out. Amyloid is a very interesting part of your innate immune system. So just as when you get COVID, out come the cytokines. Now the cytokines are there to help you. They're trying to get rid of the COVID. They're now trying to trigger initially an inflammatory response and then hand it off to your adaptive immune system, clear out the COVID. And for most of us, that works fine. I had COVID a little over a year ago, sailed through it, no major problem. And of course, that's also why people want to get their adaptive systems set up to handle it when they get it. However, what happens is if you're in poor health, for example, you now might get this tremendous inflammatory response. And by the way, COVID as a virus actually inhibits your initial response. So it hides itself from your immune system, which is why people get this cytokine storm. Your immune system suddenly wakes up and says, oh my God, I've got this horrible virus. And so it pours out the cytokines and we die of cytokine storm. Alzheimer's has something very analogous, but much more chronic. So now you have an ongoing insult, and it can be P. gingivalis from your oral microbiome. It can be herpes simplex from your lip. It can be HHV6A from your sinuses. It can be a leaky gut. You can go on and on and on. These insults are getting into your brain, and that's been well documented by neuropathologists. And now your brain responds by saying, uh-oh, I'm under attack. I'm going to start the immune process. And what does amyloid do? It coats these various microbes and kills them and sequesters them. So it's quite a good way to respond to this. And there are many people who've got amyloid in their brains and thinking perfectly clearly. But part of this is you're now downsizing. It's also now decreasing your mitochondrial function, It's decreasing your insulin signaling. It's decreasing your BDNF signaling. So it's basically saying we're under attack and we're going to live with a slightly smaller brain. And as long as you don't address that attack, what do you think happens? Smaller, 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 smaller. You die of Alzheimer's disease. So the idea of removing amyloid actually makes no sense. You have to remove the insults that are causing your brain to make the amyloid. You are dying literally of cytokine drizzle instead of cytokine storm. And this is why you can live with this stuff. You don't get a diagnosis of Alzheimer's, as I mentioned earlier, for typically 20 years after you get it. So you're actually handling it pretty well, but you've got to get in there and figure out what is causing it. Remove those things, then find to remove the amyloid, and you can do that. There are antibodies to do that. Curcumin actually helps to bind and remove amyloid. So there are a number of ways to do this, but you don't want to do it as long as it's there protecting you. It's a little bit like saying, we got a neighborhood where, cops are coming into the neighborhood and someone got hit by a stray bullet. So if we just get rid of the cops, everything will be fine. No, you need to get rid of the criminals first, then get rid of the cops.
That's so fascinating. And what I'm curious, up until this point, has conventional medicine, these drugs that they're creating, which have been very unsuccessful, we'll get into that.
Yeah.
But have they just been targeting the amyloid, or what angle have they been taking?
Great point. So most of the ones in the last 20 years have been, and by the way, it's been billions. The pharmaceutical industry has spent over $40 billion developing various treatments, which are typically anti-amyloid treatments. Now, so what happened again, people got led down the garden path by saying, when you give amyloid to a mouse, it gets a smaller brain. It looks pretty much like Alzheimer's. And in fact, when you have a mutation that causes you to make more amyloid in a human, an APP mutation, you get Alzheimer's. So amyloid must be the cause of Alzheimer's. It just didn't turn out to be that simple. So bapineuzumab, solanezumab, aducanumab, donanemab, gantenerumab, crenezumab, just go right down the list. Companies saw this incredible opportunity. We're going to have an anti-amyloid antibody. We're going to remove the amyloid. We're going to make people better. We're going to make billions upon billions upon billions of dollars. And in fact, yes, if you had a drug that really worked for Alzheimer's, this could be a $500 billion drug. So, of course, the companies were all over this and poured resources and time. And so you probably heard about all the issues of fraud. This has been a really tough year for the whole field, starting with in 2021 in June, aducanumab, which doesn't make people better and doesn't stabilize Alzheimer's disease. In one trial at one dose, it slowed the decline by 22%. That was the best it did. And so they had a meeting of 11 experts to say, should this drug be approved? And they said no. 10 out of the 11 said no. One of them said, I don't know. Nobody said it should be approved. The FDA approved it anyway. And it turned out there were some clandestine meetings between the people in the company and one of the people in the FDA. It was pretty scandalous. And of course, what's happened then is the various third-party payers have said, we're not going to pay the money. This was $56,000 a year for a drug that doesn't work. And interestingly, the FDA's statement on why they approved it was really revealing, I think. What they said was, we're not approving this because it's proven efficacy. We're approving it because it's proven to remove amyloid. And we expect that to create cognitive efficacy. But that's exactly what the trials showed isn't the case. You can remove the amyloid, you don't make the cognition worse. So again, even the FDA is missing the understanding of what this disease actually is. They fully expect, as they wrote, that when you remove amyloid, people should get better. That's exactly what all these drug trials have shown us is not the case. So again, we need to go upstream and look. Now, there are other drugs, and then there was a recent other scandal, which was for Cassava Sciences, which is developing a drug called Simufilm. And this is a drug that targets filament A. And their idea was that that's an important part of this. And in fact, interestingly, a couple of experts looked into this, a couple of experts who have become part of the venture capital world looked into the data and said, there's some red flags here. These data look fraudulent. And so they actually hired someone, they actually shorted the stock, made a lot of money from this when it came out that they were whistleblowers. They hired a guy, a scientist, very good scientist from Vanderbilt, to look into this and who spent months going through all the blots, all the data. And he said, yes, there are some real red flags here. And so now the Department of Justice has got an ongoing probe into the data from Cassava Sciences. Now, ironically, the FDA has given the go-ahead to Cassava Sciences to conduct a trial. So we'll see. We'll see how the trial goes. But meanwhile, what happened was something very surprising. The expert who was going through, this is Dr. Schrag, who was going through the blots, said, where did they get the idea to do this? Well, they got the idea from a very influential paper that came out about 15 years ago from the University of Minnesota, where there was identified a specific form of amyloid called A-beta star 56, a 56 kilodalton, so it's a 12-mer, a duodecamer of amyloid particles, molecules. These things stick together basically as oligomers. And the idea was that seems to be the most toxic form. And if you just get rid of that thing, everything's going to be great. Now, the strange thing to me was we know that multiple forms of A-beta show some toxicity, different for each one. And it looks like, this is, again, part of your innate immune system. So it's going to probably be, certain pathogens, it's going to be one form, other pathogens, another form. And so it's clear that these different ones. So the idea that another form has lots of toxicity didn't surprise me that much. But I think the authors felt that they had harnessed the cause of Alzheimer's. It's only going to be about that one. Now, what happened was when Dr. Schrag looked at their presentations, their blots, their publications, he saw the same red flags and really felt that there's something going wrong. Now, I've known the senior scientist who was on those publications for 40 years. She is a brilliant scientist, and I think it highly unlikely that she was doing anything but top-flight research. However, I don't know the fellows who were involved in that work, so I can't vouch for them, don't know what happened, and I think further inquiry will tell us whether this turns out to be something that's correct or incorrect. But again, my argument would be it's a somewhat of a fool's errand to go after all this time. It's going to be one tiny thing. All the research suggests that this is a network insufficiency. It's not one tiny cause. It's unlike COVID-19, it's not just one virus. We know insulin resistance is critical. We know leaky gut is critical. We know sleep apnea is critical. We know dozens and dozens of these contributors that are critical for people. And by the way, here's something that validates what I'm telling you. An article just came out where they followed people who'd had COVID or not for just a little over a year. And the sad, and I think we would have all guessed this, but the sad outcome was people who've had COVID were at a clearly increased risk for developing Alzheimer's in the year subsequent, whereas those who hadn't had it were at lower risk. So again, anything that is putting the drag on that system, whether it's lower supply, poor blood flow, poor mitochondrial function, poor oxygenation, low ketone level, or whether it's higher demand, inflammation, COVID, getting over COVID, all these things, they all will change that supply-demand ratio and downsize that network.
You're making such a good point here, and I want to highlight it. The fact that, and you give this analogy in your book, we're looking for a magic bullet, and what we need is a buckshot.
Exactly.
There is all these different variables that need to be addressed when it comes to Alzheimer's, and to look for a drug or a certain way of eating or anything, even in the natural health realm, that's going to be addressing one variable is not going to be enough.
And that's exactly what precision medicine is. It is silver buckshot. You are looking, if it's a cancer, you're looking at what are the different mutations that are critical. In this case, when you have a neurodegenerative condition, you are looking at all the different contributors, and then you want not just random buckshot, you want silver buckshot that is targeting each of those things. And that's exactly what we did in the trial. And we've seen now that it works very, very well. We've got people now 10 years on the approach we've taken who are still doing very well. Let me add one other thing. The idea is that you should be able to extrapolate this idea of a supply-demand chronic mismatch to other neural subsystems. In Alzheimer's, it's all about neuroplasticity, making and keeping new synapses. And we know all the different things that are contributing. We can target those. In Parkinson's, there's a different neural subsystem, and we know it's about motor control in that case. This is why people get slower. This is why people don't speak as loud. It's about the control of your movements. And what's critical there is complex 1 of the mitochondria. There's a different set of supply and demand variables. So, and then you can just go through each one. ALS has its own set. It's about motor power. PSP has its own set. Frontotemporal dementia, macular degeneration. So we now have our first data back where we've adapted the approach we take for macular degeneration. And really exciting to see people with macular degeneration getting better. And for example, dark adaptation is what functionally goes wrong early in macular degeneration. You should have less than 6.5 minutes for your eyes to adapt to the dark. And you can measure that. An optometrist or ophthalmologist can measure this for you. First person we dealt with, 13.7, so more than double what his dark adaptation could be, went on an adapted protocol that we developed for macular degeneration, recognizing that genetics and that biochemistry. He's down now at 5.38, completely normal. So we imagine, we envision that as we go forward, each of these neurodegenerative diseases should yield get in early, get a deep evaluation so that we're really looking at all the different things, get your genetics checked, and then go on a personalized precision medicine protocol for prevention or early reversal. And we really can create a world with much less neurodegenerative illness.
And for somebody who's tuning in saying, oh, wow, this all sounds so overwhelming. I feel like I'm already overwhelmed in life and busy. The good news is for people that have been tuning into this show and other information like this, a lot of what we're going to get into, the protocol that you advocate for, is stuff that people are probably already doing if they've adopted a health and wellness lifestyle. So
absolutely.
Again, we're going to get into it and it's going to make a lot more sense for people because standing on the outside now, it's like, oh, wow, it sounds like I have to manage all these different variables. But good news is you're probably doing a lot of them if you're already in this world. And if not, this is a foundation beyond Alzheimer's. This is a foundation that you're going to get into that is for living a healthy, optimized life in general, too.
Absolutely. And also, we've trained over 2,000 physicians in 10 different countries and all over the US, and of course, hundreds of health coaches as well. So, you don't have to do it alone. Get some help. Work with a health coach. Listen to Jesse, the critical things that people are doing, as you indicated. And I really do believe we're going to see in the upcoming years the prevalence of Alzheimer's declining, the incidence of Alzheimer's declining, and risk for Alzheimer's declining as people begin to understand what it is and are able to address this and never have to run the risk of getting Alzheimer's disease.
Let's get into what somebody can do when they want to take charge of their brain and their cognition. So we've gone over the continuum and how early things can start.
Yeah.
But say somebody is like, okay, there's all these different variables in the environment, and I have my own genetics that are playing into this as well. If I want to take charge, whether I have symptoms or not, how do I begin to assess, for me specifically, where I begin?
That's a great point. And so for everyone, it's easy to divide it up into the basics and the specifics. So, if you've got a specific pathogen, we're going to want to take care of that as well. But easy to start with the basics. There are 7 basics, and everyone can do these. And the good news is we understand a lot about what they do to support your cognition. And they are diet, exercise, sleep, stress, brain training, basic detox, and some targeted supplements. Everybody can do that. It's very helpful. There are paper after paper after paper. Now, everybody comes back and says, wait a minute, what you eat or whether you exercise or not, that's not a cure for Alzheimer's. No, but it's part of optimizing this network. So as I mentioned, this disease is a network insufficiency. You don't have the support. You don't have the blood flow. You don't have the oxygenation. You have too much demand with inflammation and things like that. So start with the diet. Turns out very important for whether you're going to have cognitive decline or not. And so you want to get on a plant-rich, mildly ketogenic diet. And you can go through, why. This has an amazing combinations of things. Number one, it gives you tremendous phytonutrients. Just one of these many things, polyphenols alone, beautiful data on prevention of cognitive decline. So you want to have fiber. Fiber is, again, as a scientist, I used to laugh at stuff like fiber and meditation and things like that, but I can't ignore the data. It's very clear. Having the combination, as Professor Rob Lustig points out, you need to have both the soluble and the insoluble. They work together. This helps you with your lipid profile. It helps you with your detox. It helps you with your glycemic profile. It helps heal your gut. It helps feed your microbiome. It's amazing. If someone tried to market this as a drug, they'd be charging a lot of money for it because it's something that is tremendously helpful. And most of us, as you know, are not getting enough of it. So that's another critical thing to do. So this is a plant-rich, mildly ketogenic diet with appropriate periods of fasting. And that's because we want to get you into insulin sensitivity. Insulin resistance is a big risk factor for cognitive decline. So we want to make you insulin sensitive, and we want to give your brain time to heal itself, to undergo autophagy at night. Now, there's one paradox that most people don't get, and so it's important to mention this. Because this is an insufficiency, we have to be very careful. On the one hand, we're saying do some periods of fasting because this helps you to become insulin sensitive, along with your exercise and good sleep and stress reduction. However, for people who are already frail, who have low BMIs below 20, if you are very thin, be careful, because now in trying to become insulin sensitive, you are temporarily hurting yourself by having too much fasting. So for those people, just take some exogenous ketones for a month or two while you're getting yourself to an appropriate weight and you're getting yourself to be what you want to have at the end is metabolic flexibility. Your brain can only burn those two things, glucose, ketones. Most people who have cognitive decline have failed in both of these. They've lost the ability to burn glucose well because they have insulin resistance, because they've had a high simple carb diet. And yet they've also lost the ability to make and burn ketones. They're not keto adapted. So to get best cognition, we want to make both of these return. We want to make them insulin sensitive again, and we also want to get them into ketosis. We use something called KetoFLEX 12-3. But again, just start by getting yourself into ketosis. Just take some exogenous ones if you like. Professor Stephen Kinane has done nice trials just giving exogenous ketones to people with MCI and showing improvement in them. So that's diet. Exercise.
Wait, I want to pause you right there before we get into exercise.
Absolutely.
I want to talk on the diet a little bit here. So the 12-3, just to clarify for people, the 12 is the 12 hours of fasting.
Yes.
And that's typically done where you stop eating after dinner and then you either eat a later breakfast or go all the way till lunch, depending on, again, all this is going to depend on the person's individual genetics and where they're at along the continuum with the bombardment of these different lifestyle factors, environmental factors. And then the 3 is waiting 3 hours before we go to bed after our last meal. So let's talk about the later part of that, why that part is so important to give that break in eating so you can get the most out of your sleep.
Yeah, for several reasons, but the most obvious one is your insulin comes up when you eat. Even if you eat a low carb meal, you're still going to have some degree. Your insulin responds, and you don't want it to be up while you're sleeping at night. So literally, again, a lot of what happens to our bodies is in modes. As I was mentioning earlier, you go from a mode of you're building your brain to now you're a protective downsizing mode. And that's what Alzheimer's is all about. So then now the same thing, you go into a mode of I'm eating and I'm digesting, or I'm now resting and sleeping. You don't want to cross those modes. So you don't want to go to bed while you're still eating and digesting. For one thing, your melatonin won't come up as nicely. Your growth hormone won't come up as nicely. Your insulin won't be low as nicely. So again, you want to protect the modes. And you mentioned the 12 hours of fasting. For those who are ApoE4 positive, you really want to get it more to 14 to 16 hours because you are now better at absorbing fats and you can go longer. If you take people and just take away their food, the people who are ApoE4 positive will live longer. They do better having no food, having long-term fasts. So that's why the 3 hours before bed. So you're right. You don't want to eat until 11 and then go to bed at 11:30.
Let's talk a bit about more the insulin sensitivity piece.
Yes.
And insulin sensitivity is something that comes up on the show all the time and talking about metabolic health and fixing our metabolic health. But I want to talk about it specifically when it comes to the brain and Alzheimer's.
Yes. This is such a good point for a number of reasons. So we used to do a lot of growing brain cells in Petri dishes, part of our research. And we'd be looking at what happens, what are the molecules that drive this change in APP cleavage. And so when you grow in a dish brain cells, you have to include insulin, otherwise they die. So insulin is not only a metabolic signaler that binds to the insulin receptor and signals downstream. It's not all just telling you what to do with your energetic state. It is also a trophic factor, a growth factor for neurons. And therefore, when you undergo insulin sensitivity versus insulin resistance, you are now hurting yourself both on the side of the trophic effect of insulin and on the side of the metabolic effects of insulin. And here's something interesting. There is an intimate relationship between insulin and amyloid. Who would have thought that? Number one, there is a molecule once you make the insulin that has to break down the insulin. This is called insulin degrading enzyme, IDE. Guess what else it degrades? Amyloid. And so what people found is, okay, when it's chomping away on the amyloid, trying to degrade that, or chomping away on the insulin, if it's chomping away on the insulin, it's not going to be able to do as well, be as efficient with getting rid of the amyloid. So that's a concern. And then once you make that amyloid, it actually, one of the things, and this was shown by Professor Dennis Selkoe from Harvard years ago, it interacts directly with the insulin receptor and inhibits its signaling. So it then is contributing to problems with your insulin signaling. Essentially, it looks like what this is there for. As you said, nature doesn't make mistakes. It's essentially saying we've got to downsize. We can't be building right now because we are under attack from various pathogens and toxins. So we have to go into this protective downsizing mode. So there is a direct relationship between insulin and the brain, and even these various, islet amyloid proteins, they find these things in the brain as well, making their own amyloid. So there is this really intimate relationship. Again, this is why this is a systems disease. This is a network insufficiency. You've got crosstalk between the gut and the brain, between the immune system and the gut and the brain. You've got insulin and metabolism going back and forth. You've got what kind of metabolism you're doing. What's your immune system doing? The innate immune system versus the adaptive. There's this beautiful, beautiful network that is keeping you sharp.
You mentioned the microbiome there, and there's a lot of talk in the health and wellness space about the connection between the brain and the microbiome and that being a two-way street.
Yes.
While we're on the food subject, let's talk about things you recommend for people when it comes to rebuilding that microbiome and how critical that is for brain health.
Yeah. And so first of all, I would say the microbiomes, because it's turning out that the oral and sinus microbiome are critical for brain function. And in fact, a lot of those organisms are the ones turning up in the brain. P. gingivalis, T. denticola, as I mentioned earlier, HSV1, HHV6A. So we recommend everyone, and we do this in our trials, looking at the oral and sinus microbiome, as well as you mentioned, the gut microbiome, which is equally important. And this whole issue of, do you have leaky gut? Do you have a dysbiosis? Do you have problems with your gut microbiome? So there is, as you said, there's two-way crosstalk. There's important relationships with the immune system. And then, of course, prebiotics, probiotics, and postbiotics that are all critical. And so healing the gut is one of the most important things you can do in improving cognition and reducing risk for cognitive decline. And of course, people are beginning to define, are there specific organisms? And again, I realize as scientists, our natural response is to be reductionistic. We want to know, is it just Akkermansia muciniphila? Is that the only important one? Is it just Bifidobacterium long? Is there something? It's unlikely to be one thing. It's, again, what they're finding, as you know, is that diversity seems to be the most important thing. But you can get, of course, taken over and get severe dysbiosis with various issues. And you can make some general statements, but there's a lot still to be learned about the role of the microbiome. And of course, the role in the intimate relationship with the status of your gut leak. Are you leaking, or are you actually not leaking? Are you doing quite well with your interaction with the interface between the gut and the bloodstream? So yeah, absolutely, this is an important area. It's one that there's a lot more to be known, but there's nevertheless a tremendous amount we can do today to heal the gut, to optimize the microbiome, to make sure that we have the right prebiotics, postbiotics, and probiotics.
Let's take a bit of time and get more into the oral microbiome piece, because this is something not enough people are talking about.
Yeah.
And I want to expand this out, and you get into this in the book, where even things like having amalgams or having different dental procedures or gingivitis, I think you mentioned that before.
Yes.
There's so much going on in the mouth that it's not like just brush your teeth and floss once a day. There's a lot to factor in and consider. And in your case, you're talking about how that relates to the brain.
This is such a good point. And it comes back to the point that so many of us are giving ourselves Alzheimer's by the way we sleep, by the way we floss or don't floss, by the way we eat, our diets, by the stress in our lives. I wrote in the very first book, I wrote a whole chapter on how to give yourself Alzheimer's. And the whole point of that was so many of us are doing just that without realizing it. So as you indicated, the mouth is emerging as an oral health care is emerging as one of the most important risk areas for cognitive decline and ultimately Alzheimer's disease. And therefore, it's becoming critical for people to see oral systemic specialists, dentists, who are actually trained in systemic health, so-called oral systemic specialists. And they are going to play an important role in treating and preventing Alzheimer's disease, along with the interaction with health coaches, internists, functional medicine physicians, integrative medicine physicians. All of these players are turning out to be critical. And as you indicated, just let's go into the oral area for a minute and look at all the different things that go wrong. So as you mentioned, let's start with gingivitis. If you've got some blood on your toothbrush, you know that you have a connection between your oral cavity and your bloodstream. That's a given. And this is going to increase systemic inflammation. Where are they finding these organisms? They're finding them in plaques that are giving you myocardial infarction. They're finding these organisms in cancers, and they're finding these organisms in plaques of amyloid in your brain associated with Alzheimer's. So these things are going far and wide in your body, and we want to do the best we can to prevent that. So as you mentioned, regular flossing, which again, you laugh at this stuff, but it turns out to be critical. And then knowing the microbiome, and there's an easy way to do that now with something just oral DNA, which is from my periopath, and I have no relationship with them. But again, we're just looking for best outcomes. So, and I'm sure there will be other groups that will check your oral microbiome in years to come. But they'll tell you, Do you have a high major pathogens? P. gingivalis is the one most associated with Alzheimer's, but there are other significant pathogens, T. denticola, Prevotella intermedia, things like that, Fusobacterium nucleatum, all of these things that are pathogens in the mouth. And so you can get these reduced. And in fact, we recommend that people simply use dental sidin. And again, I have no relationship with the group that makes dental sidin. We're just interested in best outcomes. And that can improve your oral microbiome. So the good news is all these things that we can now measure, we can address each and every one of them. There is something that can be done. And then you mentioned the amalgams. Here's a separate contributor. Many people who have these mercury amalgams will have so-called silver fillings that are a bit out of date, but they've been used for years and years and years, and many people have them. These can increase your mercury level, and this can increase your risk for cognitive decline. And many studies have shown that. And looking at mercury, and by the way, if you want to just give one toxin to create the pathology of Alzheimer's disease, mercury is probably your best bet. It creates both the plaques and the tangles of Alzheimer's disease. So again, looking at what your mercury status is and addressing that. Periodontitis, addressing that. It's critical. Again, typically associated with things like P. gingivalis. And then a whole other area, which is sleep disordered breathing. And it turns out, unfortunately, that so many of us grew up with not having the right exposure to things like roots. And therefore, we end up with smaller mouths, smaller airways, and we end up with sleep apnea or upper airway resistance syndrome. It doesn't just have to be sleep apnea. So we recommend everybody, please get your oxygenation checked. It's simple. You can get a little oximeter. You can borrow it from your doctor. You can buy it on Amazon for about $35. Or you can use an Apple Watch, see where you stand at night. While we're sleeping at night, we should be in the 96 to 98% range for our SpO2, for our oxygen saturation. If you're dropping down below 90, you are hurting your brain. And in fact, there's a beautiful study a few years ago where they just looked at the relationship between the average SpO2 at night and the size of your hippocampus and other nuclei in your brain. And there is a beautiful correlation. As your O2 is going down at night, your hippocampal volume is matching up. Now, again, that one study doesn't prove causation, but it's highly suspicious. So we should know if we're dropping our oxygenation at night, and that's associated with things like atrial fibrillation as well, which in and of itself is associated with cognitive decline. So there are all sorts of bad things that happen if your oral care is not good. And the good news is we can address all of them. There's a group called Vivos now that is actually expanding the airways over time. It takes a year and a half or so, slowly. It's a little bit like having braces, but in this case, you're having a retainer. They're basically expanding your oral pathway and getting better airway, better delivery of oxygenation. Such a critical thing to do. So it turns out that, as you were alluding to, what's going on in your mouth, in your airways, is a critical piece of staying sharp.
What are your thoughts on cavitations from previous wisdom tooth surgery or root canals?
Great point. And the thing is that they can be infected. And so many people don't realize that they have infection. So what we've done in our trials is to do cone beams so that you can actually look to see, are there cavitations that are being missed? And unfortunately, there can be. Are there potentially infected root canals? And these things, again, should be cleaned out. And because anything that's giving you chronic inflammation, chronic infection, chronic access of pathogens to your brains, any of those things is going to be a potential contributor to cognitive decline.
Let's jump into the exercise piece. There's a wide range of different intensities, different types of exercise. When it comes to managing brain health and optimizing, where is that sweet spot?
That's a good point. And, again, this comes right back to mechanisms. What are you doing? I'm not an expert in nutrition. We've been looking for years at the molecular biology of neurodegeneration. So you can see how each of these things contribute. You can literally trace the molecular pathway from inflammation, NF-kappa B activation, into your nucleus, turning on a whole set of genes that include ones that cut the APP into making the amyloid. So you can trace these beautiful pathways. And so in exercise, what you can do is show that you really want to have both. You want to have some aerobic exercise and you want to have some strength training. And they do different things. As an example, strength training improves your muscles, of course, which improves your insulin sensitivity and can also have an impact to increase your ketosis. When you're doing aerobic exercise, you also can increase ketones. You're saying, I need more than just glucose now. I need you to break down the fats to make the insulin. And of course, there are other things that can support your body, like creatine and carnitine and amino acids. These sorts of things get supported as well. But giving yourself some ketones, very interesting. And a group out of Cornell years ago showed that when these ketones are produced, they enter the brain and they actually interact with histones to make it so that you now remove the inhibition to producing brain-derived neurotrophic factor, which again, when it's low, is associated with Alzheimer's disease. So now the ketones are removing this block, and now you're making more of the BDNF and helping yourself. Now, what else do you do when you're exercising? You improve your blood flow. You improve your oxygenation. These are absolutely critical. That borderline blood flow is contributing to cognitive decline. So we recommend, number one, look into some resistance bands because they improve muscle formation and they improve blood flow as well. And these were used by some of the Olympic athletes, originally invented as Katsu bands, but there are other now resistance bands that you can get relatively inexpensively. And then also look into EWOT, exercise with oxygen therapy, especially for anyone who has any decrease in oxygenation or any sleep apnea or any vascular issues, so any sort of vascular disease. You can improve this with exercise with oxygen therapy. And there was a group out of Israel that had a nice study showing using HBOT, hyperbaric oxygen. Now, the one disadvantage to that, it doesn't give you the exercise part of it, but it does give you better oxygenation. So both of these things, whether EWOT or HBOT, can be very helpful with supplying your brain with appropriate oxygenation. All of these things are critical.
So what the latter you're talking about there, that's the hyperbaric oxygen chambers that people can lay in?
Exactly. Yeah, and the argument from the group in Israel is that you get the best results when you actually do cycling. And by the way, that's what's done with EWOT as well. You do cycling, so you go from hyperbaric to less hyperbaric. Now it doesn't take away oxygen, but it gives your brain a little push to make some trophic factors during that time, just for about 5 minutes. Then you go back into the hyperbaric. Now, it's hard to do that with these little chambers. They do it with the big chambers they use there. But there's no question that oxygenation, support for the brain, and blood flow, and ketosis, and the various factors like PGC1 alpha, all these things that you get from doing exercise, activating your muscles, getting your blood flow, improving your oxygenation, getting aerobically toned, all of these things are extremely helpful for your brain.
When you talk about blood flow, it gets me thinking about ginkgo biloba, and I know this is just one supplement out there, and there's a whole wide range. But let's talk about using things like that to help improve blood flow, or in separate realms, supplements in general that can help the brain.
Such a good point. And, people often say, well, look, supplements aren't a cure for Alzheimer's. Of course they aren't. They are, by definition, supplementary. But when we talked about the 7 basics, supplements one of them, targeting things. And again, it helps a lot if you know What's causing your problem? If you are a vasculopath and your problem is, vascular disease, then you want to focus more on that. If your problem is that you've got pathogens, maybe you have Lyme disease, or maybe you have another tick-borne illness, or if your problem is you're exposed to specific molds that are making mycotoxins, then you want to address those in the specific part of this. But that will also tell you which supplements are best for you. Now, as you mentioned, there are some basics we can all do. Things like omega-3s that are help, and multiple publications showing how helpful these things are. They help with an anti-inflammatory state, but they also help with resolution. So many of us have some degree of ongoing inflammation. Now, again, it's not just so simple that you just say, well, yeah, just get rid of the inflammation and you'll be fine. No, the inflammation is there because you're exposed to something. So you want to get rid of the inflammation while you're also getting rid of what it is that's causing the inflammation. Is it your oral microbiome? Is it a leaky gut? Is it Lyme exposure? What have you? You want to get rid of that. There are so many targeted supplements you can use. You mentioned ginkgo, great for blood flow. And again, by itself may not do too much, but with the rest of the overall approach to optimizing your cognition is tremendous. Curcumin, another wonderful one, which actually, by the way, binds and interacts with amyloid and with phospho-tau, helps to lower these, has a wonderful anti-inflammatory effect as well. And then you can think about things like propolis, another thing that also has an anti-inflammatory effect. And then resolvins, SPM active, for example, is a good one developed by Professor Charles Sirhan at Harvard, who spent his career looking at what is this, how does inflammation get resolved, looking at the basic biology of this and making this important discovery of the resolvins, which are related to omega-3s, by the way, and realizing that we need to use these to resolve ongoing inflammation before we then prevent future inflammation. So those are wonderful ones. And then so many people low in magnesium, and has been pointed out by Dr. Guosong Liu when he was at MIT, having some magnesium threonate, which he and his group developed, can be helpful, and they've actually done trials on magnesium threonate. But separately, it's also good to have magnesium, of course, for the gut, things like magnesium citrate and things. So all of those can be helpful. Taurine, I mentioned earlier, things like creatine for muscular status. And also, by the way, to tone down, give you a more vagal tone and tone down the sympathetic system. Melatonin, another good one. Many of us are low in melatonin as we're getting a little older and don't get as good a sleep. Now, again, if it's because of sleep disordered breathing, you got to address that. But melatonin can be in even small doses, 0.5 milligram, 1 milligram, 3 milligrams can be very helpful. Some people take it at much higher doses because it also has an anti-cancer effect. So you could go into vitamin D. There are just literally dozens and dozens of supplements. And you don't want to just take these willy-nilly. You want to know why. So the problem with Alzheimer's has been that people have been treating it blindly. They get a small data set. They say, we don't know what causes this disease. They say, we're going to get rid of the amyloid. It doesn't work. People get worse, unfortunately. Now what we can do is look much more deeply. We can look at larger data sets. We can determine why each person has the problem. And there are, as you said, there are supplements to address all of these things, whether it's vitamin D, whether it's omega-3, whether it's magnesium threonate, whether it's bacopa, ashwagandha. Ashwagandha helps to lower the amyloid as well. Shankpushpi, all of these things that can be very, very helpful.
Well, one thing that's becoming really apparent as we get into this is that for people that want to really take this in depth and make sure that they're not missing any big variables, is to work with somebody. Because we've talked about so many different, it could be mold toxicity, it could be certain bacteria in the mouth. There's all these different supplements we could be taking. Like for somebody to just try and pick different aspects and not have a bird's eye view of the whole situation seems like they could be doing themselves a real injustice.
Yes. This is such a good point. And people often say, well, gee, this sounds kind of overwhelming. Well, here's the fundamental change. Until we understood this, you knew you were going to die. It was truly hopeless. People would say to you, you go into a neurologist and he says, you have Alzheimer's disease. There's nothing I can do about it. We don't know what causes it. Here's a drug. It's not going to do much and you're going to die. A terrible, terrible situation. That is now changing so that we can really make Alzheimer's for the first time optional. And my argument is it should be optional. Everyone get on early prevention or early reversal, and let's make this a rare disease, which is just what it should be. Now, when we look at it, no surprise. I mean, are we surprised that human brains are complicated? Well, that's not that surprising. You've got about 500 trillion synapses inside your skull. You have this remarkable supercomputer that you can now keep operating until you're 100 or so. So let's do that for each person. Now, when you do that, of course, it just means you've got to look a little bit deeper. Now, the funny thing is we all are used to the fact that Google knows where you shop, knows what you're buying. Amazon knows what you're buying, what you're doing. They're using very sophisticated programs to do this. Why would we not do the same thing for something as important? Isn't our brain function as important as shopping? I mean, really, when you come right down to it. So yes, look, and they're great health coaches to work with. They're great physicians to work with. Let's look at these things and make it so that everyone, can you imagine if everyone could just say, I have no worries about Alzheimer's. I know that I'm going to stay sharp to 100. That would be a great scenario. And so if everybody, again, would get on active prevention or early reversal, we really could make this disease optional.
When it comes to somebody early on wanting to get a baseline of the biggest areas they need to address, again, we could talk about mold toxicity. We could talk about, heavy metals and all different things that we've maybe accumulated throughout a lifetime. Is there a certain grouping of tests, functional medicine tests, either blood, urine, whatever it is, stool, that you recommend for people to get that bird's eye view to see where they need to begin?
This is a really good point. And unfortunately, the vast majority of mainstream doctors are not doing it. And so we developed an approach for those who are truly asymptomatic and just looking for prevention. It's a smaller group. You don't need to do as much. And this is called PRECODE, Prevention of Cognitive Decline. For those who have already begun to have symptoms or who are not scoring really well on the testing, and you can, by the way, do a free test. It's called CQ. If you just go on your computer and look up CQ test, you can do a free test and see where I stand today. And we developed for people who have symptoms, RECODE, for reversal of cognitive decline. But you mentioned an important point, breaking it down. Let's talk. There are really 4 groups of things that you want to know that are critical for everyone. And they are the 4 groups that drive cognitive decline. So group 1, everything that has to do with energetics. And so we talked about this earlier, blood flow, oxygenation, mitochondrial function, and ketones to burn. So you want to know your energetics, and these are critical for many people. For many people, that's the rate limiting step. For others, it's not. The second thing, inflammation. So you want to know, do I have pathogens? Do I have dysbiosis? Do I have a leaky gut? Do I have a tick-borne illness? Do I have other chronic illnesses? We find this all the time where people are having cognitive decline, and it turns out that they had an undiagnosed chronic infection. And again, COVID is just validating what we've said all along. When you get COVID, yes, you have some disimmune effects. You're trying to clean that up over time. You've got some inflammation, and guess what? You're increasing your risk for developing Alzheimer's disease. So let's get rid of that. Let's get you back to an optimal immune system. The third group of the 4 then is toxicity. And you break that down into 3 types of toxins. The inorganics, things like air pollution, and there's more and more information now. Air pollution is a risk factor for Alzheimer's disease. And by the way, the people who were in the World Trade Center, unfortunately, or were first responders in the 9/11 back in 2001, an inordinate number of those people, it was actually up to 12% just by 2015, and it's continued up, have suffered cognitive decline, unfortunately. They had tremendous toxin exposure over a short period of time. So it's the inorganics, including mercury that you mentioned earlier. Secondly, organics, glyphosate, toluene, benzene, formaldehyde. And then third, it's the biotoxins, mycotoxins, trichothecenes, gliotoxin, all these different things from the basically 5 mold species. Lots of molds are not so bad, but if you want to know about Stachybotrys, Penicillium, Aspergillus, Wallemia, Chaetomium, those are the big 5 that make the ones that can actually give you cognitive decline. And then the fourth of the 4 groups is growth factor activity, trophic activity, which again breaks down into 3 types of things. The growth factors themselves, nerve growth factor, the BDNF we talked about earlier. Insulin, as I mentioned earlier, is one of the trophic factors for the brain. ADNP, go on and on. These are growth factors. And then hormones. You can trace the molecular pathways from estradiol binding to its receptor, entering the nucleus, affecting hundreds of genes, including the one that cuts APP at the good site to make it so that you're now building synapses instead of pulling back. So hormones, testosterone, things like that, and then nutrients, things like vitamin D that I mentioned earlier. So those are the big 4 groups. And you could add to that stress. It kind of comes into all those because it's part of the cortisol. It's part of your hormonal response. But you can think of that as a separate group if you want to. If you simply look at those groups of things, you can get a very good idea. And we created a computer-based algorithm so you can look very simply at what are my risks, what are the critical ones that I need to address first, so that I can make sure either to not develop cognitive decline or to reverse the cognitive decline that I have.
When you talked about air quality there, it got me thinking about air quality in the home and
Yes.
filtering the air in the home, which got me thinking even bigger to what will we do to make a brain healthy home, including the air quality.
Wow. Yeah, I'm so glad you mentioned that because that is emerging as something, again, that has been left off. When you go into an Alzheimer's expert, they never say, hey, have you checked the ducts in your home? It's just not, it's not on the table. And yet, what do we see? Here's a good example. Dr. Anne Hathaway, who is a tremendous functional medicine physician and was one of the 3, Dr. Hathaway, along with Dr. Deborah Gordon and Dr. Kat Toops, were the 3 that did that first clinical trial with me that was just published recently, in which 84% of their patients improved their cognitive scoring. So really striking. And they even, by the way, improved their MRIs. So one of her patients, it turned out who came in with Lewy body disease, which is essentially like some Alzheimer's and some Parkinson's together. And it turned out that this person had ducts that were dirty, that had mold producing mycotoxins, as well as rat droppings. So just blowing air all the time. When those were cleaned out, boom, person gets better. So that is, again, it's an N of 1, but striking associations. And so you're absolutely right. So many of us don't have brain healthy homes. Number 1, our ducts aren't clean. They're full of molds and rat droppings and things like that. Number 2, we're closing things off too much and the CO2 goes up. That's not good for your brain either. Number 3, we are living, as people have pointed out, we're living in mold food. Unfortunately, we've got a situation where we're building structures where it's wood that is now being eaten. You get some water intrusion. The molds come in, like Stachybotrys that we just talked about, or Penicillium or Aspergillus. They're now eating on your home and they're producing these mycotoxins. So unfortunately, and again, we think of this and, oh my God, even what we're doing in our home is important. Well, okay, but you can clean this out. You can improve these things if we know what is attacking us. If we know what's giving us risk for Alzheimer's, we can do so much better. So I really like your point that this is making a brain healthy home.
Well, for a lot of us, that's where we're spending the majority of our time, especially after COVID, where a lot of people are now working from home.
Yes.
And a couple other areas that I'm sure you'd agree upon are looking at the water you're showering in and drinking.
Yes. Yeah, no question. And of course, there is so much in terms of the water. And again, when we think of basic detox, we think of the way that we get rid of, we're all exposed to some forms of toxins all the time. So you've got a baseline exposure and you want to reduce that and you want to excrete that. So you're getting rid of it, urine, you're getting rid of it through your gut, you're getting rid of it, and that's again where having a high fiber diet is helpful. You're getting rid of it through your sweat. You're getting rid of it through breathing out. All of these things, you're essentially pushing this stuff out all the time. And so as you alluded to, having clean water, having filtered water is important. And again, one of the things I ran into recently that was a problem is make sure if you're using, for example, RO water, if you're using water where you've now lost the minerals, distilled water, things like that, make sure that you're not losing your own minerals. So make sure that you get some mineral replacement there. So yes, all of these things are critical. Doing saunas, there was a famous study that came out of Finland, just looking at one variable. How often did males do saunas? And they showed that the ones who did saunas 6 times a week had a much lower likelihood of developing dementia than those that just did 1 or 2 a week. So in fact, this seems to be, again, an important part of your overall detoxification. Again, sweating from exercise, following up the sweating from exercise with things like Castile soap and non-toxic soaps to help to get rid of these things. Appropriate breathing, appropriate time outdoors. One of the things I recommend to all the people with cognitive decline, please just spend more time outdoors. As you mentioned, so many of us, we're spending our lives indoors. And getting on Zoom and doing all that. Get outside, get out there and run, get out there and do things. And again, each one of these things by itself is not a cure for Alzheimer's, but each one of these things contributes to having best outcome.
And for somebody, again, who's feeling overwhelmed, they've taken in so much good information through our chat. You talk about this in your book where you want to jump in, get started. And this is going to be different. We keep harping on this. We're all different. We have different genetics, different variables that have influenced where our health is today. So we want to start working on the biggest players.
Yes.
And we want to be patient with ourselves and look at this as a long game. It's not like get off, tuning into this and go flip your whole life around. It's picking a few of these things that are going to be the biggest variable for you and then realizing you can do the rest of this over time.
This is so interesting to me. This is really getting into behavioral psychiatry and neurology. It's really telling different people like to do it a different way. So the great news is do what you like. There are people that I meet where they want to jump into 30 things at once. I want to do this. I'm going to set this. I'm going to change this, because they feel more comfortable doing that. It's like, well, I just want to throw away my old life. Julie G, for example, who set up apoe4.info, that wonderful website for people with ApoE4 positive. They have over 3,000 people who are all ApoE4 positive and virtually all doing some variation of this protocol. She wanted to just go into her pantry and throw out all the old bad stuff and the stuff that was going to give a problem. And she did that. For her, that felt comfortable. For other people I meet, they say, I want to do one thing at a time. Great. One thing is better than nothing. If you're doing 100 things wrong, doing 99 wrong tomorrow is better. Now, there's going to be a threshold for each of us. And this is very relevant for what Dean Ornish showed years ago with cardiovascular disease. As Dean pointed out, you have to get over a certain threshold to now you go from laying down arterial plaque to picking up arterial plaque, which people didn't even think was possible before he showed it. We see the same thing. You go from a synaptoclastic state where you're pulling back on synapses to a synaptoblastic state where you're now making and keeping synapses. So you got to get over that threshold, but start with one. Maybe switch to a KetoFLEX 12-3 diet. Maybe then look into your sleeping. Do the basics and just add one as you're comfortable, and you'll get to the point that you get tremendous results.
And it's important too to do this in the right order, which we touched on throughout the conversation. The fact that you don't want to just go out there and Google all the different supplements that are going to remove the amyloid. Right. It's like you got to look at the environment first and stabilize where you're at and go through this in a certain sequence.
Remember that removing the amyloid is like sending the police home. It's great if there are no robbers around. If there are no criminals, fine to send the police home. If you've still got the criminals, if you've still got all these things attacking your brain, wait until you fix those and then remove the amyloid.
For somebody that wants to implement certain activities. Say right now they're just watching Netflix at night, and I'm sure all of us are guilty
Yeah.
from time to time of getting some benefit from that, disconnecting at the end of a long day, but they want to upgrade those activities to different things that are going to be more stimulating for the brain, whether that be certain activities, reading a book. We haven't addressed this angle yet. What way can people engage their brain on a regular basis to keep it healthy?
Such a good point. And that's the fifth of you. We talked about diet, exercise, sleep, stress, brain training. So brain training is the fifth of the 7 parts of the core. And Professor Mike Mersnick from UC San Francisco years ago really developed brain training and started Posit Science, which makes Brain HQ. That is the one that actually has the most data associated. Now, that's not to say that any of the others might not be helpful. We don't know. Yes, learning a new language, helpful. Yes, Sudoku, helpful. Yes, being more engaged, helpful. Yes, solving problems, helpful. All these things. But so for whatever you like to do for brain training, great. But the most data right now are associated with Brain HQ. And there are many, many, many people on Brain HQ, as they often pointed out. Tom Brady improved his ability to see the field by using their approach. So lots of great things you can do with that. And there's a nice publication on double decision, which is one of the many programs on Brain HQ. And people who did double decision had a reduced likelihood of developing dementia even 10 years later. So lasting effects of this. So yes, you're absolutely right. Having some stimulation. And by the way, there are other forms of stimulation with light, with laser, with magnetic stimulation, so-called MERT as an example, or transcranial, TMS. All these things can be helpful. Even sound, 40 hertz light, another one. So these forms of stimulation. But remember, when you're stimulating something, there is a demand. So you want to create supply, get it yourself in a good situation, and then you're increasing that demand to essentially increase your BDNF, increase your nerve growth factor. You're giving yourself improvement in plasticity. But flogging a brain that is not being supported, again, that's not a good idea either.
For somebody that has Alzheimer's or they're on the track going that way,
Yes.
how beneficial is doing, say, 10 or 20 minutes of meditation daily to either halt, reverse, or just help things along?
Yeah, good point. The general rule is the farther along you are, the more you have to do. Not surprisingly, the farther you are from getting over that threshold. And so absolutely, meditation can be helpful. And some people like to do, whatever you like, whether you like TM, for example, whether you like mindfulness, other related things like people doing Shinroku and, forest bathing and taking periods, music, heart math, biofeedback, these can all be helpful. But if you're already having symptoms, please get to the bottom. Work with someone who has been trained, get to the bottom of why you have the symptoms and address those things as well.
Such a good point, because even with natural remedies, and this goes beyond Alzheimer's and cognition, you can use these things as band-aids, even though things like meditation or certain supplements are going to be less invasive than drugs. Both of them can be masks for what's actually happening at the root. And you can use them and go on for years, basically putting band-aids over the holes in the boat and not getting to the root of the problem if you're not careful.
Absolutely. This is why we tell people, you have a roof with 36 holes in it. This comes from our biological research that showed that there are at least 36 different contributors. We know now a few more. There, it's in the 40s. The good news is it's not thousands. It's dozens. And so you want to know what those are. And a drug is a great patch for one of them, but you want to know what these are and what are the holes in your roof to make sure to patch those, as well as do, as I mentioned, the core, the basic things like the meditation that you mentioned, which really helpful for your heart, really helpful for your blood pressure, really helpful for blood flow and that part of the conditioning of your brain.
Dale, as somebody who's been in this Alzheimer's world now for a long time, and I'm sure work with a lot of different people on varying parts of the spectrum of that disorder or
Yes.
condition, I'm curious on how you would recommend people go about helping loved ones as they're, say, later on along that Alzheimer's continuum. So somebody that wants to be a helping hand for, say, a friend or family member that is suffering. So how do they help that person? Plus, from the other angle, as somebody who is, say, a caregiver, and they're finding it really mentally draining and draining of their time, how do they protect themselves?
Yeah, that is a really good point because there is a large literature, as you know, that shows that the caregivers are at increased risk for stress-related illnesses. And there was a nice paper submitted recently on looking at the different types of personalities and how they responded differently. So the different caregiver personalities have to do with what you're going to suffer from health-wise when you're dealing with this high-stress environment. And so, yeah, I mean, these people, as you know, have higher blood pressure, have more issues with the GI tract, have more problems with shortening of telomeres. So please. So number one, please take some time for yourself. Please don't get yourself overly stressed. It's not your fault that this other person has Alzheimer's disease. Number two, there's now the first assisted living facility in the country that uses our protocols, getting very good results. It's a place called Marama. It's a wonderful assisted living facility, Marama. It's just outside of San Diego. It was started by Dr. Heather Sanderson, who's doing a great job with getting people to improve and others to stay stable. So people are not declining. Whereas, as you know, the typical assisted living facility, you go in and you just go downhill because it's the wrong environment, it's the wrong diet, it's the wrong drugs. It's just unfortunately a horrible situation. I look forward to the day when assisted living facilities are places for people to survive and improve, and in many cases, ultimately become independent again. So that's, I think, going to be an exciting time. And then, as I mentioned earlier, please get everybody in the family evaluated so that you can make sure that you end the problem with this generation. And of course, don't give up on the person. As Heather herself said, one of the first people who came into her had a MoCA score of 0, and she thought, it's hopeless. And yet she saw the person get improvements. And she has a wonderful video where she's talking about seeing people improve in an assisted living setting, which has just been unheard of before. So the bottom line here is that, unfortunately, we've all had this false hopelessness. We've been told, don't get these things checked. There's nothing you can do. We don't know what causes this disease. Medications don't help it. You're going to die. We have to change that mindset from that false hopelessness to realize you can prevent this. You can do a lot for your family. You can do a lot for yourself. And you can do a lot for the patient who has Alzheimer's or pre-Alzheimer's. Now, this doesn't mean that every single person is going to respond. And as I said earlier, we haven't seen people go from a MoCA of 0 to 30. We've seen them get back their speaking, get back some of the important basics. But we're still working on how do we get best outcomes from people who start with very low MoCA scores. So it's best to get in early if possible.
Dale, what are you most excited about right now that you think might have a great impact on that MoCA score that science hasn't been able to verify and validate just yet?
Yeah, so we're doing this in this upcoming trial. So I'm really excited about how as we're getting more and more into testing to see what you can actually find, when you have a network, it's hard to make the network work better when you can't define it very well. The more definition you have, the more ability you have to see what's changing and to see it in real time, the more you can point people in the right direction. Here's an example. We now can look at things like phospho-tau and A-beta 42 in the bloodstream, phospho-tau in the blood now, epigenetics, things that we could never look at before, electrophysiology, looking at whether someone is changing their quantitative EEG, and looking at whether someone is changing their P300, which is an evoked response, which associates with your recognition. And so we're able to see, let's say that we just changed, let's say we added EWAT last week. Now we'll be able to see, did that make a difference? Much more quickly than you'll see any difference in a cognitive score or in an MRI. The MRI takes months to change. The cognitive score may take days to weeks. but you can actually see changes in things like electrophysiology in real time. And so this helps to direct us. We're going to be able to get better and better outcomes as we know, as we can see, is the person going in the right direction or are they go in the wrong direction? And we have tools that we didn't have before. So again, things like EWAT that have turned out to be helpful, things like improving the airway that have turned out to be helpful, things like drugs that when we use them the wrong way, and a good example is homotaurine, which you can get as a supplement, this prevents the oligomerization of the A beta. So for someone where you've removed the reason for the A beta, now you want to, the fact that you've got some A beta around, you want to reduce the A beta. You can do things like curcumin and ashwagandha. You can remove the oligomerization, which is associated with the downsizing in your brain, by things like homotaurine, which again, were used the wrong way as monotherapies, and no surprise, didn't show much years ago. But we now see that as we're defining the circuits better, the network better, we really have a tremendous and growing arsenal to make things better. Magnetic stimulation, there's another example where people doing this and directing it toward regions of the brain where the quantitative EEG was abnormal are getting good results. Dr. Robert Hidea in Washington, D.C., getting good results with laser stimulation. So I think that the arsenal is growing, and the ability to use it accurately with a precision medicine protocol in a personalized way is huge.
It's exciting times. The work you're doing is just so important and groundbreaking. And I really appreciate having you back on the show and going deeper into a lot of these subjects. We're going to link up the books. We're going to link up your website, your social media in the show notes. Thank you for coming back on the show.
So great to talk to you, Jesse. Thank you so much.
Now that you're done with Dale, stick around here and catch my chat with Sean, where you're going to learn 2 key nutrients to help prevent brain shrinkage and so much more. I'll see you over there.
If you implement fasting mimicking nutrients like what we're talking about here, and I'm just mentioning a couple, like with MCTs, you're going to